So good afternoon, everyone. I'm Dr. Pravin, Medical Director for GE Healthcare, overseeing ASEAN, Australia, and New Zealand. And today we are here to talk about the topic of optimal choice of contrast media in radiology. This slide gives an overview of the different subtopics that I will cover in my presentation today. And without further ado, let's get into the actual content of what I will present today. So contrast media. What is contrast media? So they're basically substances that help improve the differentiation of certain tissue structures in diagnostic imaging. Contrast is the degree of difference observed in density. So if you look at the first set of images on the screen, you will notice that the degree of difference is quite large. And therefore, because the degree of difference is large, the object is clearly visualized. In a situation where there is no difference or there is minimal difference in the density, the object can no longer be visualized by the observer or may be difficult to observe. Now, let's take a look at the history of contrast media over the years. And this really goes back all the way to 1895, when Sir Wilhelm Conrad Röntgen discovered X-rays. Within a short period of time following that discovery, a group managed to actually understand the movement that happens within the gut, particularly the peristaltic movement, the action of the virus, and so on. And this was largely possible because of the discovery of X-ray, as well as the use of some sort of contrast media. And back in those days, it was bismuth. Now, at about 1910, they identified barium as a safer alternative to be used as a contrast media in the gut. And barium is still used until today. It was not until the 1920s that iodinated contrast medium became known as a better alternative, especially in all our radio imaging techniques that we use today. So that started off in 1923. It went on to be used in myelography, bronchography, and eventually in pyelograms and angiography. So this essentially was the beginning of how iodinated contrast media came to be used. And we've traveled a long way since then. I will actually go through some of those differences that have evolved over the years in my next few slides. Why use contrast agents? Simply to define, understand disease better, enable better diagnosis, improve confidence and sensitivity in diagnosis, enhance and differentiate between normal and abnormal tissue, demonstrate abnormal vascularity, and to better visualize blood vessels. Now, to understand the choice of contrast media, we first need to understand the important chemical properties as well as physical properties that are important in contrast media. And by that, I mean structure, osmolality, viscosity, as well as iodine content. Now, let's dive a little bit deeper into structure. So right on the top left-hand corner of this slide, you will see what is known as the ionic monomer. So notice that there is a single benzene ring, one benzene ring, with 3 iodine atoms attached to this benzene ring, and there is an ionic component. Now, there was a shift from ionic contrast media structures to non-ionic structure. This still is using a single benzene ring, so it's a monomer, but it's non-ionic. And the shift from ionic to non-ionic essentially improves the profile in terms of osmotoxicity, neurotoxicity, and also increase solubility of these structures. At the bottom of the slide, you will notice there is a single benzene ring, which is a monomer. And the combination of 2 benzene rings results in a dimer. Now, the advantage of a dimer is now you actually have a molecule that is able to carry twice as many iodine atoms compared to a structure which is having 1 benzene ring, a monomer. Now let's take a look at osmolality. Osmolality are both commonly used interchangeable terms in general practice. They essentially refer to the concentration of particles in a solution, particles per liter or particles per kilogram respectively. The osmolarity of pure water is 0, simply because there are no particles in pure water. Isoosmolar solutions contain the same number of particles in solution per kilogram of water. So isotonic solutions have a similar osmolarity as that of body fluids such as blood, CSF, and ICF. Hyperosmolar solutions have greater osmolarity than body fluids. Conversely, hypoosmolar fluids have lower osmolarity than body fluids. So why is it important to understand those few concepts concerning osmolarity or osmolality? Let's take a look at a comparison of the commonly used and historical agents as well. Right on the top, you have the first classification, which is the high osmolar contrast medium agent. Notice that the osmolarity of this agent is a lot higher than what you have as for blood, which is about 300. Moving down, you have the group of agents which are classified as low osmolar contrast media agents. Now, I'd like to point out, these are all commonly used agents, but it is important to also be aware and understand that although they are called low osmolar contrast media agents, their osmolarity is still in fact higher than that of blood. They're classified as low osmolar contrast media agents because their osmolarity is indeed lower than the historically used high osmolar contrast media agents. Moving down to the bottom of the slide, you will notice another group, which is the isoosmolar contrast media agents. And these are agents, iodixonol, which is having osmolarity that is the same as that of blood. Now let's take a look at this diagram, which illustrates what happens in our circulatory system when we inject a hyperosmolar contrast media into our bloodstream. So when this happens, it brings about a physiological movement in fluid. And it results in change in the structure of the vascular endothelial cells, enabling shift of fluids from extracellular space into the vessel. This can also bring about changes in the structure of the red blood cell. Now, these changes are often associated with what the patient may experience as a flushing or a warm sensation, which usually is transient. But it can also be associated with other effects, especially when it causes changes in the structure of the red blood cells. Let's take a look at the next property, which is viscosity. So viscosity is the measure of friction between individual particles and molecules in a fluid. There are a couple of factors that are important to think about when we consider viscosity. There are molecular shape and size, iodine concentration, electrical charge, as well as temperature. We know that round, smooth, smaller molecules roll more smoothly than irregular shaped, larger molecules. The higher the iodine content, the greater the viscosity. Even distribution or no net charge molecules roll more easily than charged molecules. Hence, as I explained earlier, the shift from ionic contrast media to non-ionic contrast media. Temperature, an increase in temperature increases the intermolecular space and thereby reducing viscosity. Hence, the recommendation to warm the contrast media agent to body temperature prior to administration. Now, I mentioned in the earlier slide factors that are important to consider when we look at viscosity, and iodine concentration is one of those factors. It's important to also be aware that iodine content is considered to be one of the determinants in the quality of the outcome of the image. Iodine constitutes approximately up to 50% of the total molecular weight of contrast medium. Now, let's take a look at this table. You would see a range of different concentrations, as well as reasons for selecting these different concentrations based on the type of procedures and the conditions that you would like to actually examine the patient in. put it very simply, a higher concentration of above 300 milligrams of iodine per milliliter is usually used in situations where you would need optimal visualization, injection into high flow areas, especially into intraarterial injections. This would typically involve procedures like autography, procedures in the cath lab, cardiac catheterizations, rapid bolus CT, and so on. The lower concentrations, 300 and below, would typically mean that you are having some sort of a trade-off in image quality and also considering the outcome for the patient, as well as the type of procedure that you're trying to actually carry out. So let's take a look at what we have available, which is iohexol. You've got two different concentrations, which is your 300 as well as your 350 milligram in Vietnam. And based on this, if we refer to the local prescribing information, the product information, you now have an understanding of when 350 is the preferred choice of concentration, largely because you would like to have optimal visualization as well as the type of procedure which I explained earlier. Now, I've covered quite a bit in terms of the properties of the contrast media, and namely their structure, osmolarity, viscosity, as well as the iodine content. Let's take a look at how those elements, those properties have evolved over the years in terms of how the use of contrast media has also changed over the years with the different classifications. So right at the top of this slide, you would see the ionic monomer group. And these are typically the high osmolar contrast agents. Please note that they are called high osmolar contrast agents and their osmolarity is about 5 to 8 times higher than that of blood's osmolarity. Moving into the 1980s, we then have the classification called the low osmolar contrast media agents. These agents are typically the non-ionic monomers as well as the ionic dimer. They are called low osmolar contrast media agents. Their osmolarity is lower than that of the high osmolar contrast media agents, but the osmolarity is still higher than that of blood, but with some improved hydrophilicity in the non-ionic monomers. Right at the bottom, you have iso-osmolar contrast media agents, which is a non-dimer, and that's where iodixanol is. This has an osmolarity that is equal to that of blood. Let's get more into detail on the actual agents that are available, specifically iohexol. Iohexol, or Omnipac, is a low osmolar contrast media agent. It is a non-ionic monomer, water-soluble X-ray contrast medium. It's got a long history of usage, about 40 years. It's used widely globally. And if we do a quick PubMed search, you would end up with a large number of publications to date, which have mentioned iohexol. And this really ties into its long history of use as well as its wide usage. The table below shows the two different concentrations that you have available in Vietnam. I mentioned earlier in terms of when the high concentration of 350 is the preferred choice based on the type of procedure to be conducted, as well as the image that you would like to achieve in those conditions, as well as your 300 milligram, which is available in the market, and the indications are also specified in your local product information leaflet. This is your local indication in Vietnam for iohexol. I want to point out here that it's got a wide range of indications, which is used in IV, intraarterial, intrathecal, as well as used in body cavities. And this is very much aligned to what we have globally as well. Now, I mentioned earlier a couple of points about iohexol being widely used, a long history of usage, large number of publications and information that we have in terms of the product usage, safety profile, and so on. Now, I also want to point out that iohexol is the only LOCM, low osmolar contrast media agent, that is listed in WHO model list of essential medicines. This is a list that is put together based on medicines that are based on their efficacy, based on their safety profile, as well as cost effectiveness. Essentially, what it means is this is the minimum type of medication that is needed in a healthcare system, and iohexol is listed in this list. Now, you would usually have contrast media agents packaged in a glass bottle with an aluminum cream foil, or it may come in a glass ampule. A couple of things to consider in this sort of packaging, particularly to do with potential for breakage, potential risk of injury or of breakage of the glass or even from the foil, and also depending on your local policy and your local practice in terms of disposing sharp wastage. This is something to keep in mind. Iohexol is the only LOCM that is available in a polypropylene plus pack packaging. Therefore, potentially and possibly simplifying some of these issues. Let's take a look at iodixonol, which is VCPAC. It is a isoosmolar contrast media agent. It is a non-ionic dimer water-soluble X-ray. Also with a long history of usage and used widely. These are the two different concentrations that are available. And keep in mind that the osmolarity of these agents are the same as that of body fluids and blood. This is your local indication in Vietnam for iodixonol. It's indicated for use in IV use, intraarterial use, as well as use in body cavities. Now we've come to the end of this presentation. This table gives an overview of the commonly available agents that are usually used in many different markets. I've gone through the important properties in terms of selection and use of different contrast media agents, iodinated contrast media agents. By that I mean structure, which is your benzene rings, which make it a monomer or a dimer. Your charge on the molecule, which make it an ionic or a non-ionic agent. Your iodine content, the viscosity, as well as the osmolarity of the agent. So we have iohexol, which is a non-ionic monomer, and we have iodixonol, which is a non-ionic dimer, and it is an isoosmolar contrast media agent. So to wrap up, the use of contrast media agents are important in order to have proper clinical diagnosis. The use continues to increase, and agents that are chosen and used should satisfy in terms of maximum efficacy and at the same time with minimal secondary effects. And throughout the years, agents have evolved in order to improve patient tolerability while maintaining the image quality and sometimes even improving image quality. GE offers iohexol, which is Omnipac, and iodixonol, which is VCPAC. And these are your local Vietnamese labels for iohexol, as well as for iodixonol.